Hi guys, this is Ayushi and I'm back with Dr. Damerla. Why is it important to understand child development and the unique mental health issues that they go through?
Childhood development is a fascinating and it's a very dynamic phase. And children are constantly growing. They are attaining different milestones on a daily basis. Not everything that they go through is abnormal. Most of it is normal. However, it's important to also know the fact that childhood mental illnesses that start obviously early and then they proceed to adolescence and into adulthood. If you catch them early, the chance of you doing something is better. In general, when a kid is very well adjusted, you'll be able to see that they are able to interact with their peers well, they're able to enjoy their play well, they're able to go to school, participate in activities. In general, having good time, the appropriate phase in their life. But there is some disruption, then it could signal a problem. And also one important point to make a note of is that the same illnesses that occur in adulthood occur in childhood as well. However, the expression of those mental illnesses is different because children are different. They have not attained the maturity. Their brains are not fully mature like they are in adults. For example, depression in adults presents with sadness, not being able to enjoy, being hopeless, so on and so forth. But in a kid, it would probably present differently, like temper tantrums or being very irritable, not wanting to go to school. And there are some unique illnesses such as, for example, ADHD or attention deficit hyperactivity disorder. It can happen in adults too, but typically their onset or they start during childhood.
Can you tell us a few common childhood mental health issues that specifically occur in the South Asian community?
Actually, the same mental health conditions that occur in adults occur in children. Similarly, the same mental health conditions that occur in the rest of the communities also occur in South Asian and Indian community. Kids have anxiety. They're apprehensive, they worry at times, and they also can have temper tantrums. So not everything means that they have a mental illness per se. Disorder is when you have like a persistent symptom that causes so much distress that begins to impact them in school or their play environment or at home. So having said that, it's common to see anxiety disorders. There's a few examples of them. Separation anxiety disorder is common. And then you have obsessive compulsive disorder, post-traumatic stress disorder, typically when there's abuse and other issues involved, unfortunately, which does occur in the community. And you have attention deficit hyperactivity disorder, which is by far the commonest. And there's other disorders like depressive disorder and bipolar disorder. Very rarely we see things like schizophrenia in children, but if there is a suspicion of that, they have to be evaluated. Regardless of what disorder it is, they have to be evaluated by a mental health professional and if possible, a child and adolescent psychiatrist as well.
So Dr. Damerla, since you mentioned it, could we find out a little bit more about ADHD?
ADHD or attention deficit hyperactivity disorder is probably the commonest disorder that occurs in children and adolescents. And typically, about 3 to 5% of kids have ADHD. It starts typically in early childhood, before the age of 12. And there's 3 types of ADHD symptoms: inattentive type of symptoms, hyperactivity type of symptoms, and impulsive type of symptoms. There's also 3 types of disorders. ADHD, which is inattentive type. Then you have the hyperactive impulsive type and the combined type. The combined type of ADHD is probably the commonest that we typically see. So when we say inattentive type of symptoms, we are looking at not being able to focus properly, difficulty in paying attention, not being able to be organized, making careless mistakes, being forgetful, not being able to listen when they are spoken to or given instructions. Those are the types of inattentive symptoms that we commonly see. And then with hyperactivity symptoms, we normally see not being able to sit still, squirming, fidgeting, running around. Usually they're called as kids with a motor. They're on the go all the time. You can't stop them. And they talk out of turn, running out of line. But however, this is persistent. It does impair the kid at school and it does impact them somewhat negatively at home and their play arena, so on and so forth. And then you have the hyperactive impulsive type. Sometimes these kids also are very disruptive and they can get into trouble by getting into fights and getting into arguments. That can also be there. And so the impulsivity is prominent feature in these kids. So when you have all these symptoms present together, it's a combined type of ADHD. If it's mainly the inattentiveness that's present, then it's an inattentive type of ADHD. And if it's only the hyperactive impulsive type, but their focusing is good, then it's the hyperactive impulsive type of ADHD. I must say that it can be effectively addressed. And there's one known researcher of ADHD who used to say that is the rule of thirds applies here, meaning a third of the kids get better and a third of the kids kind of remain the same, and a third of them tend to get worse. But all said and done, if you pick it up early, intervention happens early, chances are that it can be very effectively addressed. Medication tends to be the mainstay of treatment. However, other interventions also can be very helpful.
Thank you, Dr. Damerla. That was very valuable information. If you think your child or loved one needs help, please contact the Los Angeles County Department of Mental Health at their 24/7 helpline at 1-800-854-7771. Your call is safe and confidential.